linear. Obviously, you've just heard a long journey, 16 years of healing, but it's not linear just because the survivor has gone through X amount of healing. There are still things that come up in milestones, relationships, things down the road, so that it's good to keep in mind to walk alongside survivors even years down the road. So this is a part of my story that I have never actually shared publicly in this way at a conference or anything, any of the speaking that I've done. So you're the first group to hear it. It's going to be brief, but I think it's really important. It is the medical component 15 years later. So in May or June 2004, that's when I was sexually assaulted. And at that time, I obtained kind of an internal injury, like some scar tissue internally from the assault. In July 2006, the trial ends and the healing really begins. I initially had a SANE exam done by, some of you may know Wendy Gladstone. She was a pretty big forerunner in the PD SANE program and SANE nurse examiners for years. I know she's a familiar name to some people. I don't really remember anything about the exam, but I discovered when I was 15, 16, and 17 that I was unable to wear tampons. As you know, I was growing up, going through these phases of hormonal changes and things. It felt like there was a wall there, and it was extremely painful, overwhelmingly painful. And then age 17 through and beyond college, I had endless physical pain whenever I tried to be normal, to be able to use those during my time of the month. And it was increasingly frustrating because I felt like something was wrong with me. I thought I was crazy. I couldn't understand after all the years of healing that something could still be wrong, or that something was wrong, although I knew it was directly correlated to what happened to me. So in 2016, I was in a plane crash. That's another presentation for another day. It is a miracle that I'm sitting before you today for many reasons, as you can see, but this really catapulted me into another level of healing that I didn't even know that I really needed. And so I started to really pay attention to my body after the plane crash, and I had some abdominal injuries and things like that. So I was really paying attention to that. It was like zoning in on that part of my body. And because of all the healing and the deep seed of faith and hope that I had, I was able to really face it head on pretty quickly. I had the complete honor to work with Deb Sorrentino. She's our PD SANE at Children's Cove, and she is an incredible woman, an incredible nurse. And she gave me some resources in Boston to some specialists to try to tackle this thing head on. And so I made some calls in November, December of 2018. And then in January 2019, I was diagnosed with vaginismus, pelvic dysfunction, and pelvic pain, all rooted from trauma. And this is really what I'm talking about when healing is not linear. You know, I had gone through so many stages of healing. I was telling my story in front of hundreds of people, but I still had this one piece that I wasn't ready to face. And I had gone to the gynecologist when I was like 17, and it was a really traumatic experience for me. And I swore I'd never go back or tell anyone that I had a concern. So it really literally took a plane crash for me to face it, because as much as, and I know I'm not alone in this, that survivors who've been through abuse as children or adolescents go on and have issues later on physically as adults. And the body responds in a way to protect us at the time. But the more that it wasn't dealt with, my body kind of retreated back, and it became like a wall, and it became impossible for any type of penetration, even just for that time of the month. And so it was excruciatingly painful. It took me about 6 months to even get a well woman exam done, a regular pap smear. It was excruciating. I would get nauseous, I would get lightheaded, I would get sick. I would pass out. I passed out once at the doctor's. And so after we kind of worked through that, I had an amazing primary care, and I started to cultivate a team around me of people. So I had my specialist in Boston, my local doctor, a gynecologist, and then a pelvic floor physical therapist. And I started my treatment of pelvic floor physical therapy in January of 2019 until May of 2020, twice a week. It was a difficult process, to say the least, but I was able to really document my experience. I created an Instagram at Victory Over Pelvic Pain to share my experience. I did a reflection twice a week during my treatments. You know, and I had so much support during that time. I ended up having to get on temporary FMLA at work, and just to be able to manage the treatments because I would get so nauseous and have to go through, I was on Zofran, like they give cancer patients for nausea. It was not a pretty process, but I can tell you today that it was so healing, and I just want other women, other survivors to know that there's help and there's hope out there even with this. And so I found healing and wholeness more than I thought I ever would, and more than I ever thought was possible through this part. So the value of the medical, I was able to many years later request my medical exam from the Child Advocacy Center and the courts. And so that was really helpful to inform my decisions medically. As an adult, I felt completely capable of reading those reports myself, and also being able to bring those to the doctors that I was seeing regarding this. And so I just wanted to talk to you a little bit about the value of the medical exam. Initially, if this had happened, this component would not have been in there, but through some kind of prayer and just a deep knowing that this is an issue that survivors have, I wanted to be a voice. So I actually asked two of our own, Deb Sorrentino and Rachel Nemec, to talk to me about their perspective on the value of the medical exam. And then in the context, I was able to talk to them about my journey and my perspective as well. So from Deb, knowing that the survivor's body is healthy and normal, and if it is not, knowing that and assuring that there is healing and treatment. These are just some points that they brought to my attention. Body parts can be a mystery. The medical exam can be reuniting survivors with their body in a positive medical way, and it can be so healing. It can bring holistic healing, that wholeness that I talked about. For teens especially, oftentimes teens have hard questions, AKA they don't want to talk to their parents. We see that all the time about sexuality and STIs. It's a confidential and private conversation with a nurse. It can be really empowering for teens to know that their body's okay. It helps parents who have a trauma history to understand what they may not have had as a resource at the time, and knowing that's available to their kids now. Valuable information for years to come on the healing journey, like I just talked about. I was able to empower myself to get those records, to get validation that I wasn't crazy, that there was something detected years ago, and that, you know, they did think it was going to go away with my body as it grew, but it actually grew with my body. And it gives the survivor power that was lost during the abuse and assault for use for healing down the road, like I talked about. It gives the survivor knowledge and health promotion for overall wellness, just knowing about their body and not being afraid of their body, and embodying their survivorship. For example, at 12 years old, I didn't understand the value of the medical exam, and 15 years later, it was the most valuable thing for the final piece of my healing. And oftentimes survivors shelf the incident at the time. They can't handle all the things that go into healing, and they later may need or want more information for the healing, and that way there is access for them. For example, I had an exam at 12 and I didn't remember much about the exam itself, but I requested records in the healing process and was able to review them. And this is a little bit, never underestimate the purpose and value of the medical exam. The body heals. The body heals so remarkably well. The exam gives reassurance and validation to the survivor. And there's often a body disconnect, that someone used the body of the survivor. And it helps survivors reconnect with their body to feel whole again. And it's a disservice if we don't talk about it. The exam is a place to explore together in unity. It gives power and connection back to the survivor that this is yours, your body is yours. The key is to walk beside survivors in this, to remind the survivor that the abuse and assault doesn't define their relationship with their body. The scars that no one can see are often present, but there are scars left behind. Injuries that you do see are often only visible and knowable to the survivors themselves. If done well, the CAC down the road might be the place where kids want to come back to see records or have a conversation. And kids have questions, and it's truly remarkable. And it gives kids and teens and adults courage to face GYN issues as teens and adults down the road, especially for females. Down the road, there's validation. This validation is crucial. It was crucial for me to defy the feeling of crazy about what was going on inside my body, and what the body is telling you as a survivor. And it impacts the overall health, especially gut health and hormones and the cycle for females. There is so much power that comes from the space of the exam. There's conversation, reconnection to self. There's hope as things are changing. It's imperative for survivors to need someone to be gentle, calm, and kind physically and emotionally to their body. Your body will speak to you, so access to this care will be helpful, not harmful to survivors. There's so much healing that can be provided in these exams in other ways, and this is often the last piece. Survivors don't even know healing was needed here until milestones. For me, it was relationships, sex and intimacy, and potentially marriage down the road. There is no blanket response to these exams. There's a framework for every kid, teen, and adult survivor. It's different. And transparency is crucial, telling kids what may be on the horizon. It might not be true today, but down the road, and a reminder, the exam is an ultimate reminder that the survivor is not alone. And then I wanted to